Hello everyone. In this lecture we are going to discuss about the review of structure and function of urinary system. Here, when looking towards the urinary system at a glance, it is a purification system for the blood. It maintains fluid, electrolyte and pH balance and remove toxins from the body. And it consists mainly four organs: kidneys, ureters, bladder and urethra. Urinary system, when we look at a glance, the function of urinary system can be categorized shortly as it maintains internal environment, stable internal environment, remove waste products, adjusts water in electrolyte level, and maintains correct pH. The function of urinary system. First of all, the kidneys. It regulates the blood volume and composition, helps to regulate the blood pressure and pH, participate in red blood cell production by secretion of erythropoietin hormone and synthesis of vitamin D, and excrete waste products and foreign substances. The ureters transport urine from the kidney to urinary bladder. The urinary bladder stores urine and expels urine into the urethra, and the urethra discharges urine from the body. Okay, now let's discuss about kidneys, the anatomy of kidney. The kidneys are a pair of small bean-shaped organs that lie on either side of the spine, located just below the two ribs in the level of 12th thoracic to 3rd lumbar vertebrae. The functional and structural unit of kidney is nephron, and each kidney contains 1.2 million nephrons. And each nephron consists of Bowman capsules that surround the glomerular capillary tuft, and the proximal convoluted tubule, the loop of Henle, and the distal convoluted tubule, which empties into the collecting duct. And the urine formation begins in cortex and continues flowing through the tubules and collecting duct, and the formed urine then enters the calyces and renal pelvis and finally exits the kidney through the ureter to the bladder. We can see here the coronal section of the right kidney. This is also the cross-sectional view of the kidney. We can see here the calyces, renal pelvis, medulla, cortex, ureter, renal veins, artery. The kidneys take their blood supply directly from the aorta via the renal arteries, and blood is returned to the inferior vena cava via the renal veins. We can see the internal structures of kidney. First of all, the cortex, which is the outer portion. Medulla is the inner portion. Pyramids are the triangular shaped structures in the medulla, and the papillae are the tip of each renal pyramid. We can see here again in the figure, these are the calyx, renal papillae, renal pyramid, renal pelvis, helium, medulla, cortex, and here is the ureter. Calyx, it is the small opening area that receives urine from the each papillae. Renal pelvis, it is the large opening area that receives urine from the each calyx and empties into the ureter. And here we go to nephron. These are the parts of nephron. Nephron are regarded as the functional unit of kidney. They are the microscopic unit, and the more than 1 million nephrons are in each kidneys, and it consists of renal corpuscle, and renal tubules. Renal corpuscle consists of two parts: glomerular or Bowman's capsule. Blood flow through the glomerulus. Substances filtered from the blood and enter the glomerular capsule. The renal tubule consists of the four sections: proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting tubule. The filtrate flow through the renal tubules to complete the urine production process. In the further slide, we will go to the physiology of micturition as well. We can see here the structure of nephron again clearly. This is the glomerular capsules, efferent and efferent arterioles, glomerulus. These are the renal veins, renal arteries, proximal convoluted tubule, distal convoluted tubule, collecting tubule, and peritubular capillaries. Okay, the three stages of urine production are: it moves through the renal tubule through three stages, that is filtration, reabsorption, and secretion. Filtration, it takes between the glomerulus and Bowman's capsules, and the filtrate it produced water, glucose, amino acid, and waste, and the filtrate enters the renal tubules. Then after reabsorption, as filtrate moves through the renal tubule, water and the desirable molecules are reabsorbed, return to blood in the peritubular capillaries, and waste and undesirable molecules remain in the renal tubules. And then in the secretion stage, as the filtrate moves through the renal tubules, additional waste products removed from the blood in the peritubular capillaries and added to filtrate in the renal tubules. Okay, here also we can see A, filtration takes place here, B, here the reabsorption takes place, and here the secretion takes place. Now the ureters. The urine drain from the renal pelvis into the ureter, extend from the renal pelvis to urinary bladder. We can see here from the kidneys to urinary bladder and lined with the mucous membrane. They are lined with the mucous membrane. We can see here the uterus extend from the kidney to the urinary bladder. And the urinary bladder, it is the elastic muscular sac, the smooth muscles tissue. It is lined with mucous membrane and folded into rugae, and it lies in the base of pelvis and behind the pubis. Symphysis pubic. We can see here the more clear view of bladder, urine bladder. These are the ureters, bladder, prostate in case of male patient. Oh, sorry, in case of male, and urethra. Urinary bladder, it receives urine from ureters and stores urine. It can hold to 250 ml of urine and excrete, and up to maximum 500 ml of urine and excrete through urethra. Involuntary muscle action causes bladder to contract, internal sphincter to relax, and the voluntary muscle controls the external sphincter. We can see here the imaging view of the bladder. Now the urethra, the tubular canal that lined with the mucous membrane is the urethra. We can see here in the picture as well. It is 1.5 inch long in female and 8 inch long in male, and it carries urine from bladder to outside of the body, and the external opening is called urinary meatus, and the releasing urine from body is called micturition, or we can also say voiding or urination. Here in the figure, we can see the male urethra that extends from the urinary bladder into the floor of pelvis, through the penis into the urinary meatus. And this is the female urethra. We can see here it is most shorter compared to the male urethra. It extends from the urinary bladder to the floor of the pelvis and exits just in front of the vaginal opening. Okay, now we come with the physiology of micturition. The emptying of bladder, it is initiated by the micturition reflex. The reflex is controlled by central nervous system, and when the bladder is about half full, the stress receptors in the wall of the bladder becomes active and send signals along the pelvic knobs to the spinal cord. A reflex signal is sent back to the bladder, which makes the detrusor muscles in the bladder wall contract. The contraction increases the pressure in the bladder, and this is what makes us feel want to pass urine or want to void the urine. Because the external sphincter is under the voluntary control, we do not urinate until we decide to relax this muscle. Okay, this was all the review of anatomy and physiology of urinary system in short, in brief. Here are the urinary system vocabularies. Here Let's go through the frequency means greater urge to urinate or no increase in total volume of urine, that is only the urge to urinate is greater. Hesitancy means decrease in force of urine stream, often with difficulty initiating the flow. Micturition means another term for urination or voiding. Nephrology means diagnosis and treatment of disease and condition of the kidney. Renal colic means pain that is caused by the renal stone. Strictures means narrowing of a passageway in the urinary system. Similarly, uremia means accumulation of waste products in the bloodstream. Urgency means feeling the need to urinate immediately. Urinary incontinence means involuntary release of urine, and urinary retention means inability to fully empty the bladder. Urology means diagnosis and treatment of the disease and condition of urinary system. Boarding means it is another term of urination, which already we have said. And here are some of the kidney pathologies. Let's go through these also. Acute tubular necrosis, ATN. It means the damage to the renal tubules due to the toxins in the urine, and that results in oliguria. Diabetic nephropathy. It is the damage to glomerular capillaries due to the high blood sugar in diabetes mellitus. Glomerulonephritis, it is the inflammation of the kidney, more permeable to protein and blood cells. Hydronephrosis, distension of the renal pelvis due to accumulation of urine in the kidney. Nephrolithiasis, it is the presence of calculi in the kidney, solidification of salt in the urine. Nephrotic syndrome, damage to glomerulus, protein appears in the urine. Nephroptosis, downward displacement of the kidney, floating of the kidney. Polycystic kidneys, formation of multiple cast cysts within the kidney, destroys the normal kidney tissue. Okay, here we can see the figure. The polycystic kidney on the left, which is compared to the normal kidney on the right. Pyelonephritis, inflammation of the renal pelvis and the kidney, common type of kidney disease. Renal cell carcinoma, it is a cancerous tumor of the renal tubule cells. Renal failure, it is the inability of kidney to filtrate the waste, result in uremia. It can be acute renal failure and chronic renal failure, which we will discuss in further lectures. Wilms tumor, that is a malignant kidney tumor, most often found in the children. Here are some urinary bladder pathologies. Bladder cancer, it is a cancerous tumor arising from the cell lining bladder. Symptoms, the major symptom is hematuria. Bladder neck obstruction, BNO, the blockage of the bladder outlet, often caused by the enlarged prostate gland. Cystocele, protrusion of the uterine bladder into the wall of vagina. Interstitial cystitis, inflammation and irritation of the bladder. Neurogenic bladder, loss of nervous control lead to retention. Urinary tract infection, which is also called UTI. It is the infection of any organ of urinary system, usually from bacteria. Begins with cystitis and may ascend into ureters and kidneys. Blood urine nitrogen, BUN. These are the clinical laboratory tests. We will go through the clinical laboratory test in detail in next lecture. Bond, CC clean catch specimen, creatinine clearance, urinalysis, urine culture and sensitivity, which we call urine CS, and diagnostic imaging are cystography, excretourography, EU, intravenous pyelogram, kidney ureter bladder KUV X-ray, retrograde pyelogram, voiding cystourethropography, BCUG. These all are the diagnostic investigation which we will go in next lecture in detail. Endoscopic procedure, that is cystoscopy. And here are some of the medical treatments that are related to urinary system, that is catheterization, which is the insertion of tube through urethra into the urinary bladder. Extracorporeal shock wave lithotripsy, It is used of ultrasound wave to break up the renal calculi, hemodialysis, use of artificial kidney machine to filter the blood. Similarly, peritoneal dialysis, which removes the waste using the chemically balanced solutions placed in the peritoneal cavity. Okay, this is the picture which can show the extracorporeal shockwave lithotripsy. It is a non-invasive procedure which uses the high frequency sound wave to shatter the kidney stones. Okay, we can go through this in detail in next lecture. This is also the picture of patient undergoing hemodialysis, peritoneal dialysis. Okay, here are some of the surgical treatments. Lithotripsy, which means crossing a stone in the bladder or urethra. Meatotomy, it is the incision into the meatus. Nephrolithotomy, incision to directly remove the stones from kidney. A renal transplant, it is the surgical placement of a donor kidney. Okay, here is a figure that illustrates the location utilized for implantation of the donor kidney. You can see only one kidney here, which is the transplanted kidney, and in this side we cannot see the kidney. Okay, some urinary system pharmacology. Antibiotics are used mainly for treating the bacterial infection. Ciprofloxacin is the choice of drugs, and antispasmodic, which prevents or reduces the bladder muscle spasm. Nitrofen and prostaglandin are commonly used drugs, and diuretics, which increase the volume of urine. Lasix, Alactone are the commonly used name of drugs. Okay, here are some of the urinary system abbreviations. You can go through these also. Thank you, everyone. In the next lecture, we will be discussing about the different diagnostic investigation and nursing management related to those investigations. If you have any queries, you can ask me in the message box. Thank you for listening.